Arthrodesis, posterior or posterolateral technique, single level, cervical below C2 segment. Thoracic, with lateral transverse technique, when performed. Lumbar, with lateral transverse technique, when performed. Each additional vertebral segment. The physician makes an incision overlying the vertebrae and separates the fascia and the supraspinous ligaments in line with the incision. The physician prepares the vertebrae and lifts ligaments and muscles out of the way. A chisel elevator is used to strip away the capsules of the lateral articulations, and the articular cartilage and cortical bone is excised. Separately reportable chips are cut from the fossa below the lateral articulations, and from the laminae, or fragments of the spinous process are taken and used to fill the interlaminal space and the gap left by the articular cartilage removal. Additional bone grafts are taken from the ilium or other donor bone and are used to join the laminae. The periosteum, ligaments, and paravertebral muscles are sutured to secure the bone grafting. The skin and subcutaneous tissues are closed with sutures, as well. When two surgeons work together as primary surgeons performing distinct part, S, of an anterior interbody arthrodesis, each surgeon should report his/her distinct operative work by appending the modifier 62 to the procedure code. In this situation, the modifier 62 may be appended to the procedure code, S, 22548 to 22558 and, as appropriate, to the associated additional interspace add-on code 22585 as long as both surgeons continue to work together as primary surgeons. Arthrodesis, posterior interbody technique, including laminectomy and/or discectomy to prepare interspace, other than for decompression, single interspace, lumbar. Each additional interspace. Part of the lamina may be removed on one side and/or part of the disc may be removed to facilitate preparation of the interspace for fusion. Additional bone grafts are taken from the ilium or other donor bone and are used to bridge the laminae. The periosteum, ligaments, and paravertebral muscles are sutured to secure the bone grafting. The skin and subcutaneous tissues are closed with sutures as well. Arthrodesis, combined posterior or posterolateral technique with posterior interbody technique including laminectomy and/or discectomy sufficient to prepare interspace, other than for decompression, single interspace and segment, lumbar. Each additional interspace and segment. Laminectomies and partial facetectomies are performed to facilitate preparation of the interspace for fusion. The intervertebral disc is removed using rongers or curettes. The disc space is measured and a bone spacer, graft, metal, or plastic, is inserted between the vertebrae. A bone graft is placed alongside, lateral, the vertebrae to be fused and is used to fill the interlaminar space and the gap left by the articular cartilage removal. Separately reportable additional bone grafts may be taken from the ilium or other donor bone used to fill the disc space and join the laminae. Separately reportable spinal fusion instrumentation may be placed to stabilize the graft. The periosteum, ligaments, and paravertebral muscles are sutured to secure the bone grafting. The skin and subcutaneous tissues are closed in layers with sutures.